So moving on from getting our finger pricker ready, we now need to actually prepare the service user and yourself to take the sample for blood glucose testing. So what we need to do is choose which finger we're going to test. So what I've done is I've just marked on one finger here roughly the areas where you're going to be using. We do try and avoid the pads of the fingers. The pads of the fingers are really important to keep as sensitive as possible, and if you're hammering away with finger prickers onto the same area over and over again, the sensitivity is lost in the fingers. Unfortunately, as people's progression with diabetes sometimes leads to visual problems, so they're more dependent on their sensitivity if their vision if they're losing their vision. So try and avoid the pads, so keep them to be nice and sensitive. So if you look at the outsides, I've marked these off, that's the kind of area we want to be looking at, alongside but not too close to the nail bed. The nail beds themselves are quite, they would make your service user jump, and they wouldn't trust you very much if you were to start putting the needle too close to there. So you look at that area there, you can see it's kind of on the side of the finger. You could probably go a little bit higher than that, but just avoid the pads. Generally speaking, people will tell you all sorts of different things about which finger you can use. I tend to recommend that we use these three bigger fingers here, the little ones and the thumb. I find the thumb seems to bleed an awful lot, and the little one, it's just quite difficult to get a target on there, but some people will tell you otherwise. Often it's down to the service user's own choice, and other factors, such as whether the fingers have been damaged by repeated testing over the years. Okay, so in preparation for taking a sample of blood or pricking the finger to get the blood, what we need to do is go off and wash our hands, but we need to do it with the service user if possible. Now you need to try and put that into the routine that you have with your service user. So you've got your consent, your permission from the service user to be able to do this. So you might want to go and wash your hands together at the same time as part of that routine. Give you a focus on what you're going to be doing. So your service user sees you washing your hands, it's good that you both wash your hands together. And of course you both need to wash your hands. If that's not possible for whatever reason, then what I would recommend is a wet wipe. Now this is just a piece of gauze. You can use a piece of kitchen towel, you can use some tissue, but tissue tends to break up a little bit when it gets wet. So I just use a little piece of gauze, and this is just some I've cut up. So what you would need to do, get a wet gauze and wipe the area. Let's say I'm going to use that area there. I'm just going to wipe it with a wet gauze, clean it, and then I'm going to let it dry, or I'm going to use the back end of that. So if I've wet half of it to wash it with, I'm going to use the other half to dry it. Okay, so it's important that it does get dried, because if you prick their finger and blood comes out and it's onto wet skin, that will dilute the sample, and it's such a tiny sample that will impact and it will affect the result. I recently had a case where I tested somebody's finger. I didn't dry it properly. I tested somebody's blood, and the reading was 1.2. Patient was looking at me, asking the question, what was my blood sugar? I said, I think it's incorrect. Went through the process again, dried it, and found their blood sugar to be 10.4. So you can see how there is a potential for error from washing or not washing. So when we clean the skin, it's really important that it is clean, because, as I said, the tiny sample that you take, if it picks up something from the surface of the skin, it will change the result. So what we want is a result from the blood, not from the surface of the skin. And just the same, that too much water on the surface, if the water on the surface dilutes your sample and gives you a duff reading, it might also give you a duff reading if there's some residue of food on the fingers. So make sure they're clean, make sure they're dry, ready to have the test done. Okay, so to get blood out of that person, I'm going to use one of the Unistix 3 sample testing finger prickers. And what I'm going to do is I'm going to push it against the surface of the skin like so. Now it's obviously a two-handed thing if you're doing it on somebody else. I happen to be doing it on myself at the moment. And what I'm going to show you, if I show you close up, if I press that down firmly, you'll see, hopefully, a little circle of dots. Now that little circle of dots is essentially just pushing down on a bit of skin to bring it up like a sort of a raised area. And when the needle goes into it, it will be more effective in how it bleeds. So you have to push firmly down, not so firmly that you're damaging somebody, but you push firmly down and then you press the trigger. A lot of people say at this point, little scratch coming. I tend to find that by the time you've said it, it's already happened. Press the trigger, goes click, and then take the finger pricker away. That needs to go straight away into the sharps bin, which should be nearby. Now your blood, as you can see on that green line, there's some blood. Now don't try squeezing it out there if it's not coming out. Start from the top and move your hand down. Remember, warm fingers bleed better than cold fingers. Now there's my sample. I should already now have my machine ready to take the sample from there. Okay, now it shouldn't sit on the surface for too long. It should sit on the surface for 1 or 2 seconds, then we should be in there taking our sample with the blood testing with the machine.